This is Jerry Hesch. I'm a physical therapist at Hesch Institute in Aurora, Colorado. And this is a presentation on lower pelvic asymmetry and treatable hypomobility. Diana has a fairly symmetrical pelvis in supine, and she has good mobility when I perform a spring test on each ilium, and a side shear test demonstrates good mobility. Let's have you lie on your stomach, please. She presents with a symmetrical pelvis palpating the posterior landmarks, and the top of the pelvis is symmetrical, bottom of the pelvis is symmetrical. She has symmetrical spring mobility going vertically through each hemipelvis, going inferiorly on each side, but she has a distinct impression that her pelvis is twisted to her left. And she's very aware that she moves asymmetrically, such as when she bends forward. Now, when we palpate the bottom of the sit bones, that's where we encounter an asymmetry. So here's the skeletal model, and here's sacrum, and here's the hemipelvis. This is the sit bone. And the way she presents is with respect to the gluteal crease, the midline crease. She presents with both of the sit bones shifted over and rotated to the left, and the tailbone is shifted over to the left as well. So when I put my thumbs medial to the sit bone, the midline crease is right here. Her body crease is consistent with the crease of her clothing, and there's only about 1 inch of space on this side, and there's about 2.5 inches space on the left side. I'll try and get that from a different camera angle. So this is the bottom crease of the buttock. So this is thigh. And this is the bottom of the sit bone here. And I come medial to it. I'm touching bone, I'm touching the sit bone, and I come medially on the left. And I think you can see that asymmetry. But more importantly than how something looks positioned, the question becomes, did she develop this way? Is this her norm? Did her pelvis develop asymmetrically and it's not changeable? Or does this represent a movement dysfunction? And if it was normal, then I would be able to induce spring mobility, but I'm pushing to the right with a fair amount of force and I'm not getting any movement. And now I scoop medially and get the slightest soft tissue movement, but when I try and create bony movement, there's no give there. So this is, in my opinion, an induced injury, and when I try and push it over to the left, I can hardly take up the slack, and then the movement is lost. And if I impart additional force going this way, there's no movement. And when I do the same thing on the left, there's no movement. This is a pattern I discovered, and I've named it lower windswept pelvis. And again, it's based on the spring testing, not based on position. So it's a treatable pattern, and I have other YouTube videos that show the treatment of this pattern. I'll stop filming now and I'll treat her, and I'll show you the results, and I'll go ahead and show you how I restored mobility. So we'll stop filming now and we'll treat her and come back and refilm.